My name is Stacy Drury, and I am the Chief Research Officer for Children's Hospital and the Vice Chair of Research for Pediatrics at Tulane University. For the last 5 years, I have been directing pediatric clinical research at Tulane and most recently started at Children's Hospital. So the best part of my job actually is the ability to help bring high-impact clinical trials to the children of Louisiana and the Gulf South. So clinical trials are our way of understanding both how disease processes work and how our treatments work for different children and different adults throughout our population. They are run by organizations such as Tulane or places like the National Institute of Health, or sometimes even pharmaceutical companies working to really understand how a medication or a novel treatment might actually improve health for a variety of people.
I'm Dr. Keith C. Ferdinand, Professor of Medicine at the Tulane University School of Medicine and the Gerald S. Berenson Endowed Chair in Preventive Cardiology. America is a very diverse society. Differences are found between race, ethnicity, sex, gender, and geography. It's important, therefore, when we have a new device or medication, to be ensured that this new breakthrough in medicine can be applied equally to all populations.
Hi, my name is Dr. Eric Griggs, and I've been involved with clinical trials from every stage of it, from the animal models or the bench work to chasing a dude down the street, trying to get my pills back. For a lot of people, there was a period of time when I was involved in clinical trials where it was hard for people to get healthcare coverage. And what would be interesting is once they would sign up in a clinical trial, not only, there were a lot of times that they would get a stipend to be a part of it, which was a great carrot, but they had healthcare. They were monitored while they're on the clinical trials. And that's what people need to understand. The other thing is you get to feel like you're one of the cool kids, right? Helping to evolve and do the science things that will benefit all of, I guess, especially in COVID, all of humanity, right? I tell people it's kind of empowering. So there's a lot of benefits, the cost, healthcare, and self-awareness. People come out really empowered. The first thing is, can I quit? Is this something that I'm obligated to if I just don't feel comfortable? And the answer is absolutely. You are in full control. The second thing is, I ain't no guinea pig. Well, good. We're not doing guinea pig experiments. We're doing testing on humans. You're not a guinea pig. You are a participant. You will be monitored, even on through every phase of it.
There are multiple mechanisms that are now in place to make sure that patients are protected when they participate in a clinical trial. For instance, there's something called an IRB, or Institutional Review Board. These are people who are not actually participating in the trial, but look at the trial's methods, the persons who are doing the trial, the particular type of tests or interventions that are being utilized, and make sure that everything is being done above board and ethically.
There's so many eyes. There's the IRB, there's your principal investigator, there's your sub-investigator, there's nurses, and anything that might be wrong that could possibly be a side effect or a result of something happening while you're in that clinical trial, you have medical supervision. So that's one of the big things.
I am Mariana Montero, originally from Ecuador, and I am the executive director and founder of the Golden Change Inc., which is a non-profit organization, and the mission is to empower. Another very important part is to know more about your own health, and to be a Latino and participate in these programs and make it like we are part of this community.